So what exactly is a total knee replacement surgery? What happens and what's being replaced?
Okay.
That's a big question, I know.
Okay. Well, let's go back, if we can, briefly to the knee models.
Let's do it.
Remember, there's that cartilage that lines every bone in our body called articular cartilage. Mm-hmm. And when it wears thin down to raw bone, eventually this becomes very painful, and you run out of non-surgical options to try. Mm-hmm. So at that point, when no other option exists, and the criteria for doing a knee replacement is not based on an X-ray, it's not based on an MRI. I've seen horrible looking knees where people are still playing in the NFL or the NBA.
Wow.
And I've seen knees that really don't look that bad where people can't live with the pain. So your indication for doing joint replacement surgery, for the most part, is when you can live with the pain. Some people can't sleep, some people can't walk, some people can't travel, whatever their criteria is. So once you have this arthritic looking knee, you will replace it at surgery with a knee that is basically metal and plastic that you literally glue to your own bone.
So this is actually the area, if you will, that you're replacing.
Yeah. And there's a lot of preparation that goes into replacing a knee even before you go into the operating room. But basically you have to fashion the bone and replace it with a metal, and the plastic is called polyethylene, and it's as frictionless as possible because you want this to hold up for many, many years and not wear out.
Okay.
It's not like tires where you can easily change them.
Every 6 months.
Okay. And then when you literally glue this back, and under the kneecap, you kind of slice off a portion like that.
Let me just show this right here. Go ahead.
You slice off a portion, and you'll put a little plastic kneecap on that underside.